Hello everyone. In this session we'll start with the different types of insurance and the insurance mechanisms. So we'll talk more about insurance markets, insurance mechanisms, different insurance stakeholders, how do they work, operations as well. So generally, if we look at the insurance market overall, there are three kinds of insurance. One is private insurance. So the first thing can be the public insurance, private insurance, and employer sponsored health insurance. Health insurance. As the name suggests, so the public insurance are those which are supported by the government. Private insurance are those which are generally individual level, and employer sponsored health insurance are those which generally are funded by the employers or the organizations one individual, one person is working for. Now, when we look at these, the differences across all these, so the first thing will be the type of insurance. So when we talk about the type of insurance, it's basically say private insurances are voluntary, public insurances are not really voluntary, but the government wants to cover all the sections of the population depending upon the scheme's objective. So one particular scheme, maybe they are targeting the below poverty line people, one particular scheme they are targeting the pregnant ladies, one particular scheme maybe they are targeting the elderlies, so there is it's kind of a mandatory or a particular scheme for a particular section of population who are working for the government. So it's a kind of employer sponsored health insurance, but coming from this government. So the coverage intended is 100%, and if the person is tracked or if they are convinced, then they are going for the health insurance, but there is nothing such voluntary. Whereas private insurance is absolutely voluntary, that the agent or the third party administrator will learn about that shortly. So they will approach the individual customers or potential customers, and they will try to sell their insurance as a commodity, as a good insurance, as a market good. They will try to sell them. Whereas employer sponsored health insurance, it is often mandatory that when I join an organization, I take an insurance. I can kind of a bargain, engage in a bargaining with this health insurance with my organization, that I don't want this health insurance because I have already got maybe one or two or multiple health insurances. So that is a different story altogether, which happens at the personal level. But when I'm joining an organization in a formal setup for the formal permanent employees, they have to have an insurance. So this is the basic differences in terms of type of insurance. Second can be when to enroll. When to enroll. When we talk about when to enroll, it is like, say, both public and private insurances are generally enrollment happens throughout the year. Private insurances are, of course, they will approach you, they will come, and once if it is a renewal, then there is a time period that before that the policy get exhausted, I have to renew that. So that is there is a time period, a window. But otherwise, for a new enrollment, there is no such window. The agents or the third party administrators or the insurance companies, they will approach us, and we are getting the insurances depending upon our feasibility, our affordability, and all this. Whereas for public insurances, in certain cases, it's of course throughout the year, but in certain cases, if there is the insurances are being given to some section of the, say, in a particular village for a particular section of the population through some health camps and all, then the enrollment will take place only during those health camps. So say in my village, the government brings a health camp, they will do our basic checkups, and they will forward us an insurance scheme. So, and I get enrolled in that insurance scheme when this opens up, and the employer sponsored health insurance generally opens up during a particular time period. That is what these employers are going to decide, that when they are going to open that particular window, and when when this coverage starts. In terms of when the coverage starts, the coverage in case of public or private insurances, it starts immediately, whereas in employers, in employer sponsored health insurance, it depends that what the health insurance scheme is offering, and you need to talk to the employer that when my coverage starts and how it is starting, and all the nitty-gritties. So that probably you don't have any idea about that, and then the employer is actually dealing with the health insurance organization or the third party administrator, and then you need to talk to them. Whereas the private and public insurance, generally they have a mandated time period that just after this or immediately the health insurance is activated. The fourth point can be the cost. Now this cost depends upon several factors. When these public insurances, in several cases, they are completely for paid by the government. The insurance is paid, the premiums are paid by the government. In some cases, the insured people also need to pay a small amount of money. In some cases, the total claim, if it is within a certain range, say 60,000 rupees, then the insured person don't have to pay. If it is more than 60,000, then they may need to pay certain amount of that extra 40,000 or something. Say if they now have to pay 1 lakh, so over 40,000 they need to pay certain amount. So that is differing with the scheme to scheme in public insurances. Whereas private insurances, it is mandated, it is mentioned in this health insurance policy that what is the co-payment, that how much is the co-payment that the patient needs to pay when they claim the insurance's benefit, and at the same time what is the premium they are paying. In public insurances, they are most of the cases they don't have a direct premium payment mechanism, whereas in employee sponsored health insurances, you need to ask that how much is being deducted from your salary towards this health insurance, how much the employer is giving. So again, it differs from the employer to employer, it differs from the insurance companies with whom the employer is registered with, and it also depends upon your own experience rating, which is done by the insurance company or your employer based on your age, your designation, your health profile, and all this. So again, it varies from case to case. The third thing can be, the fifth thing can be healthcare providers. Which are the healthcare providers who are associated with each of these schemes? Healthcare providers. In public insurances, most of the cases, all these government hospitals are empaneled with these schemes. In certain cases, say, and in India, in several in terms of public-private partnership, several private hospitals are also, or charitable hospitals are also coming forward to help help the government to release its load, because with these schemes the health seeking behavior have improved, and then a lot of patient flow towards these public health setups, and then it is finding it difficult to manage, and then several private hospitals have joined hands and then are trying to help the government hospitals. And so these are the healthcare providers. In certain cases, the say in CGHS, central government health scheme, so they have got their own dispensaries, own hospitals, or ESIS, so they have their own clinics, all these things. So the healthcare providers are different in terms of public health insurance, and when I go to the private health insurance, they clearly mention which are the hospitals empaneled with a particular private health insurance. So all these hospitals list have to be there, and you have to be very sure that you know the nearby hospitals before you meet with with an accident or an emergency period, you have to know that which are the hospitals empaneled closer to you with your health insurance scheme which you were registered with, and then you can decide that whether which one will you choose. But when you have say 3 hospitals near to you, but none of them are registered with your health insurance schemes, and during emergency you don't know where to go and which are the hospitals, you just assume that they are there, you went there, and then you unnecessarily lost time. So private insurance are very clear about which are the hospitals they are empaneled with, which are the hospitals which give you cashless benefits, which are the hospitals which give you the benefits in terms of now you pay and then you get the payment back, I mean the money back from the health insurers. And next is that employee sponsored health insurance. Again, you need to ask it from your employer that which are the health insurance companies are registered under my health insurance, because most often you don't have these even if you have the card, but you don't have in the entire document with you. So you need to ask and check it with your HR manager, and to be sure that you have proper idea about the healthcare providers, which is a very important component of the health insurance, of any health insurance. So however, there are certain and in terms of private health insurance, there is one more point while we talk about healthcare providers, because there is a concept of PPO and MCO, preferred provider organization and managed care organization, or health maintenance organizations. PPO and HMO together are known as MCO, health maintenance organization, preferred provider organizations at points of services. Together they are known as managed care organizations, a very popular framework in US healthcare systems. So in these private health insurances, these are basically private health insurances, while HMO is well supported by the government, by the federal government in US. Otherwise, what happens that these are generally form an umbrella under which they bring the medical practitioners, the doctors, the hospitals, the diagnostic centers, the insurance, the pharmaceuticals, everybody together. Right, again that's a private health insurance, and in that, if you have you are a registered member of such organization, preferred provider organizations, or health maintenance organization, then you have a clear idea that which are the hospitals or providers you can go to, and it is your choice in most cases, not mostly in PPO but not in HMO. We can have a detailed discussion over this. Anyways, in terms of problems, what we find in case of private insurance, that private insurances are the profit making agencies. So when in order to make profits, they generally follow what we learned, they follow several 4 mechanisms: charge high premium, or charge low premium, charge high premium, low customer base, low premium, target high customer base but keep high co-payment, or you do cherry picking. So all these things, you have to figure out as a private health insurer, but at the same time there are certain negative aspects in it. While we do cherry picking, we form a death spiral, that while we select only the healthy people, only the educated people, only the people who are employed with the formal education, then we are leaving out the sick, the poor people who basically desperately need health insurances, where we are ending up giving insurance to them who don't require at that point of time. At the same time, this will create a death spiral, because in that while we are doing this cherry picking, in that scenario we are actually keeping we are leaving those who require insurance as uninsured. That means now not having insurance has poorer health. Many people will poorer health is a poor society, and we are causing a death spiral. right? Now, in this death spiral, what eventually happens in that, every competing individual health insurance organization are competing with each other, and then they are trying to cherry pick and trying to find the best of the population, or the population with lowest risk to be insured under them. The more they cherry pick, the stronger is the death spiral. Yes, while everybody tries to cherry pick, not actually having a nice mix of healthy as well as unhealthy people, then all these uninsured people are basically poor, old, unhealthy, and this finally has an impact as a adverse effect. You know, one is the moral hazard. One is moral hazard and another one is adverse effect or adverse selection. Therefore, in terms of adverse selection, so two adverse effects, one is adverse selection and another one is moral hazard. Now, adverse selection is while everybody is trying to get the best of the trying to cherry pick or get the healthy people insured, then many of them in search for more and more larger and larger customer base, what they are doing, they are actually ignoring the experience rating. Once they are ignoring the experience rating, they are in a risk, falling in a risk that they are finally insuring people who are lying to them that they are healthy, but eventually they are not healthy, right? So while again it's a competition, everybody is being desperate. Therefore, that particular health insurance company has actually misunderstood an unhealthy person as a healthy person, and then estimated their probability of sickness as wrong. Once they have estimated the PS, probability of falling sick, wrongly, they are estimating their expected payout lower and may fall into, and then they are based on their expected payoff, they are estimating their premium, which is now they are charging less, and they may fall into a trap where they are making loss. So that is that one adverse selection, and when the insurance companies are making loss, then they are not interested, they lose interest, either they will move out of the business or they will lose interest to do any charity, or they will move out of this ideology. They also need to insure unhealthy people. The second one is moral hazard. I briefly spoke about that when people have insurance, they will also go to the doctor to have their nails trimmed. That means that if for a minor problem, say it has happened, I have personally seen that case, that a person has broken her arm, and then she has went to a hospital or nursing home to have her elbow plastered. They said that, do you have health insurance? Having a positive reply, they said, don't worry, you stay back, you just get hospitalized, get admitted, and then your this cost will be covered. And she estimated that the cost is eventually lower if she stays back with the hospital, right? And that is moral hazard from both the sides, because one, hospitalization is not required but the person is getting admitted. Moral hazard from the patient's part, or the trimming of nail can be done by themselves, and then it's an extreme example, doesn't happen like that, but still they are still going to the doctor at the same time when the nursing home or the hospital is indulging that you stay back, and then because they will earn a lot of money out of that, and then it's a win-win scenario for both the patient as well as the hospital. But who is losing out? It's the health insurance company. So these are the two basic problems with the private health insurance what we find often. The problem with the public health insurance in a country like as big as India, as diverse as India, is to target them. The people mostly they don't have awareness about this health insurance programs, health or the schemes, and the even if they are enrolled with the schemes, you know, the hospitals or the health centers are so far away that they cannot actually avail that. So even if the affordability now being ensured by the governments, the accessibility has remained a problem. And slowly it takes time, and eventually there are government schemes like say government schemes like ESIS, where they give money for the transportation. In CGHS they are trying to give money for the transportation, that till 30,000 coverage, if they come then they will be paid 100 rupees, something like that, you know. So so that the other costs apart from these healthcare treatment costs, the opportunity cost, the transportation cost, opportunity cost of not going to a job, you know, because they are mostly daily wage earners. So these are being covered so that the health seeking behavior is improved. So that is how we, and of course with the employers health insurance schemes, I don't know what kind of health insurance I have with my employer, so we never bother to ask them. We know that we have an health insurance, but we never know that whether that insurance will really work out or not. And so this has remained a problem. Even for private health insurance, there has been a problem in terms of this awareness, because we don't know which are the hospitals. You know, even you ask most of these educated people, they don't have idea. I didn't have idea a few months back maybe. Thank you.